それでは第1部を始めます。はじめのテーマはエコチル調査の現状と今後の展望です。まず本日の最初のご講演は最近の地球環境の変化と子どもの健康についてと題しまして WHO 世界保健機関環境及び社会的健康要因部部長のドクターマリア・ネーラ先生よりご講演いただきます。簡単にマリア・ネーラ先生のことをご説明いたしますと、内分泌学代謝疾患の専門家で、環境要因社会的要因が人々の健康に与える健康やリスク等のさまざまな場面でその重要性を訴えられていらっしゃいます。それでは、ネイラ先生よろしくお願いします。
Dr. Mori, Dr. Kishi, dear participants, excellencies, colleagues, people interested in children's environmental health, thank you very much for this invitation and this opportunity to be here. For people like me from Europe, we never know very well the cultural code, so I don't know whether I'm supposed to do this in front of you. In any case, I would like to express you my satisfaction, feeling very privileged, and definitely very happy to be here today and grateful for this opportunity. Let me then start with my presentation on the recent global environmental change in children's health with a global perspective, quite general, understanding that the participants here today are coming from different backgrounds, different interests, but our common interest here today will be children's environmental health and how this links to the enormous study that you are conducting here, to the fantastic opportunity that you are giving to the international global health community by the GEX study. Let me maybe, for those of you who are not very familiar with the World Health Organization that I'm representing here today, tell you a little bit what the function of the organization is about. And in fact, according to our constitution, our function will be to act as the UN directing and coordinating authority on international health work. And then our objective will be the attainment by all peoples of the highest possible level of health. And the definition of health, and probably you heard that many times, but I think today is more important than ever to understand that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And I'm insisting on that because the big study that Japan is conducting now is all about that. It's looking at the primary prevention. It's looking at the causes and not only at how we can treat the patients, but how we can avoid our populations to get sick. This represents where do we have our regional offices. WHO headquarters is in Geneva. You are all welcome there to visit us. Some of the Japanese colleagues are visiting us from time to time, and we have the privilege even to have now a secondee from Chiba University. And I hope that this will create a bridge that will facilitate exchanges with Chiba University. Professor Mori is from time to time as well giving us the privilege to come and to do some teaching there. And this is always a way to raise awareness about the study that you are conducting. As I was saying, apart from our office in Geneva, we have regional offices in Washington, covering all the region of the Americas, Copenhagen for the European region. We have in Cairo, in Egypt, a regional office for the Eastern Mediterranean region, New Delhi for Southeast Asia region, and Manila for the Western Pacific region. And downstairs you have some of our milestone or one of the big achievements by WHO. Polio is one of them that we are still trying to eradicate, and I hope that others will come soon and will be added to this fantastic collection of big achievements in global public health. Maybe the study that is being conducted here in Japan one day could be added to this list. Our Constitution started in 1948, and there is nothing more fantastic than being working for the cause of protecting people's health. Let me now work a little bit more on something more concrete. What are how the environment is impacting our health, and what can we do to change that, and how we can move this agenda in order to avoid the terrible burden of diseases that today is caused by exposure to environmental factors. This is data produced by WHO more than 10 years ago. And I'm very happy to share with you that in a couple of months from now, this data will be updated and we will have new figures regarding how much diseases could be prevented if we tackle environmental risks. Now, today, what we have is that environmental factors cause more than 25% of the global burden of disease and significantly contribute to the burden of communicable and non-communicable diseases and injuries. And every year, about 3 million children under 5 die due to disease linked to the environment. Let me put this in a very positive way. The positive message here is that because we know that, because we know what are the diseases that can be associated or there is a fraction of risk that can be attributed to that disease, the good news is we can reduce by 25% the global burden of diseases. And that means an enormous part of the mortality that is occurring every year. And if we focus particularly on children, this might represent a fantastic achievement. The burden of those diseases is obviously highest in the poor countries, but there will be wrong to think that environmental risk factors are causing disease only on developing countries. Obviously, issues like lack of access to safe water, of sanitation, might not be affecting countries like Japan or most of the European countries, but issues like air pollution, for instance, might be affecting still one of the, developed countries, and all of us, as you can see, we are at risk at different proportions, but we are all affected by those environmental factors that can be modified. As I say, this will be updated very soon, and I will be very happy to present that data in Japan, hoping that this will represent yet another push for outlining the importance of the study that is conducted here. What are those main global environmental health risks? Some of them are very well known, and everybody knows it: the poor hygiene and sanitation, household water insecurity, disease vectors, chemicals in our environment, chemical hazards, injuries and accidents, and now recently air pollution, indoor and outdoor air pollution, which is representing one of the biggest public health challenges that we are facing at the moment. We can look as well at what we consider somehow the emerging issues, even if some of them have been there for a long time. One of them will be electronic waste. What are we doing? What the rich countries are doing with electronic waste many times is ending in Africa or in other continents, in developing countries, where children are used to recycle the little pieces of electronics that can be still used, lead from car batteries, for instance, causing a lot of problems on their health, or endocrine disruptors, whether we can still call it emerging or they are already a very well-defined environmental risk, or ozone depletion, or persistent organic pollutants, or the global climate change that, as you know, finally and hopefully, and it was a fantastic achievement in Paris this last Saturday, so 3 days ago, a great treaty has been signed by 195 countries on reducing global warming and not going beyond the 2 degrees Celsius centigrades by the end of the century. That will require a completely different world, and that will require to move on a green economy and different patterns and start to decarbonize our society. Air pollution deserves a special chapter because, as I say, this is now becoming one of the biggest challenges that we have in public health, and one of the most important risks for health at the level of tobacco, for instance. And this is because the impacts can be as big as more than 7 million premature deaths every year caused by exposure to air polluted, resulting from indoor air pollution, because half of the world population, believe it or not, because you are on a very industrialized and developed countries, but still almost half of the world population is still used for cooking or heating or lightening their household. They are still using very basic vegetal coal or fossil fuels, which are the incomplete combustion resultant from this open fire is causing particles in the environment that then they go to the lungs of the baby and the mom and the bloodstream, causing respiratory and cardiovascular diseases that are so damaging for our health. On the other extreme, you have the polluted air resulting from unsustainable transport systems and even the poor diet that are including a lot of meat, for instance, in meat production. And those are major contributors to the non-communicable diseases. Chemicals is an important part of this study, and therefore we thought that we can spend a couple of slides on why chemicals are important for our health. Obviously, chemicals are contributing a lot to our life, daily life, in a positive way. There are many stories about chemicals contributing positively in our hospitals to better disinfection, or in our daily life. They are facilitating our daily life. But somehow as well, if we don't have a proper and appropriate and strategic approach to how we use the chemicals and how we commercialize those chemicals, when we look at the data from US EPA, for instance, the high production of chemicals is over 500 tons per year. We have chemicals going into the commercial life without being able to check all of them, and the impression we have is that we still have at the tip of the iceberg, and somehow the chemical production is going far beyond or at a speed that the public health community cannot follow properly. In addition to that, when this prevention fails, you have, or we had only in the past years, to respond to many crises caused by exposure to chemicals, like in Hungary, which is Europe, so you see that the toxic sludge and mood that occur, or in Nigeria, when we have a mass lead poisoning caused by the fact that the children were recycling lead batteries from cars, or earthquake resulting on major sanitation and water problems, why not to mention the Fukushima event and the Russia wildfires in 2010, or the mass bromide poisoning that we have in Angola in 2007. This is when our environmental risk factors are associated with outbreaks or major emergencies, and therefore represent a major crisis that we need to respond on a different scale around the world. The program on children environmental health is based on the fact that we need to make sure that not only we have a department in the World Health Organization with working with many collaborating centers that I'm pleased to today they are represented here, some of them, or institutions like EPA or other institutions that we are working on daily basis, Germany, France, United States, and Japan. But we thought that in addition to that, it was a need for having a special program on children environmental health for obvious reasons. The children are exposed to unique ways of exposure. They have, because of their physiology, because they have a dynamic developmental physiology, they will be exposed in a different way. They have a longer life expectancy. So we need to make sure that this exposure at the early life is not causing a problem in the many years they have in front of them to live. And obviously because somebody has to represent them because they are politically powerless. So we recognize as well that we as the health professional, understanding by health professional a very large spectrum of professionals on public health, researchers, scientific community, academia, people working at university, scientists, we have a responsibility on diagnosis and treat, publishing, doing research, putting the scientific evidence there, but we have as well as responsibility on educating our communities, our patients, our families, and then colleagues and students, and making sure that there is an understanding of the importance of exposure to children to, in this case, chemicals that can represent a problem for them. So a big advocate role. And we need to, if possible, produce and provide a good leadership and a role model for others around the world. So in that sense, why these children cohort studies are so important for the global public health community? Because this is the way we have today to know the actual environmental exposure. Not every country can do that. This is very costly. This will require a major engagement, not for 1 year, nor for 2 years, but for many years. It's a big financial engagement as well, but somehow it's a moral responsibility to do it on behalf of those who are totally without any financial resources. And those studies will help us to answer the questions of the cause-effect relationships. So between the environment, environmental chemicals and the children's diseases, what is the linkage? What is the cause effect? How sure can we be about that? And how can then use that scientific knowledge to then propose public health measures and change the way or reduce the exposure of the children? And obviously those cohort studies will provide an opportunity to collect biosamples, which are treasures, as somebody was defining yesterday. This is a Japanese national treasure, what we are doing here, and that will be helping the rest of the world. Obviously, the challenges is that everybody's enthusiastic at the beginning, but those studies are terribly time-consuming. The cost is very high. The parents might get tired and bored because this is human nature, and you need to motivate them. You need to find a way to keep the motivation. And obviously, the best way to keep the motivation will be to concentrate on the health outcomes that can be obtained from such a study. And the staff might get tired and a little bit bored as well because the routine work and all of that. But please be aware that the whole world is looking at you now. We rely very much in the good sense. We are looking at you, hoping that the study you are conducting, and nobody else in the world is having such a study with the number of children that you have engaged in the study is there. So from a World Health Organization point of view, what you are doing here is extraordinary. We rely on you to one day get the results and use it not only for Japan, which was obviously the main reason, but for the global, for the international, to be able to share with others and to extrapolate your results and use it at the international level. So for those of you who are feeling a little bit bored or tired, please renovate and revitalize, and you are the best. I don't know what else to tell you, to keep pushing. We need you. So don't give up. This is fantastic what you are doing. And as I say, this data that you are producing from 100,000 children and their parents, this is really very, very powerful. So you don't have the right to give up. You have to keep on it. So if you are bored, we need to introduce some little changes that will be stimulating, a little chocolate anytime you do 10,000, whatever. I'm sure you can work on something stimulating. Think about the people outside Japan that is looking at you. because these results, as I mentioned, will help global health communities to understand more precisely the impact on children of their surrounding environment. And the outcomes of your study, apart from the glory that we are all ready to give you once the study will be finalized, and I hope we will be able to celebrate, the outcomes will help administrators to develop public health measures to protect children. And obviously, we hope that we will be able to prevent possible adverse health effects if we learn what the causes are. And of course, we are learning, and we need to learn very quickly on what is happening here. So to before my 1 minute paper was shown, I know that the timekeeper ready to show me the 1 minute left. I'm anticipating that, and I'm almost finishing saying that hopefully, one day we will celebrate here at the same level we celebrated in Paris on Sunday. You know, Paris Agreement on climate change was not only excellent for the international community and something historic, unprecedented, and landmarking. I think for France has been a fantastic moment as well on repositioning. And I think France took a big risk on hosting the Climate Change Summit in Paris, but the risk paid off. So I'm convinced that the effort and money and all the commitment, political commitment that you are putting on this study will pay off. And I hope that Tokyo one day will celebrate at the same level we celebrated in Paris last Sunday. So the last request, and I know that this is too much, but if instead to children be followed after 13 years, until 13 years, we could follow them until 18, that will be wonderful, but it's just for consideration. So with that, I really thank you, all of you, and we are ready as WHO to take the results of that, to disseminate it, and to protect as much as possible the future of our children. Your study will not only protect Japanese children, but will protect children all around the world. So thank you very much.